So the research we're going to talk about today has to do with a clinical trial of Efgartigimod, which is an FcRn inhibitor, to treat chronic inflammatory demyelinating polyneuropathy, or CIDP. The current treatments for CIDP have been available for probably over 30 years, which includes corticosteroids, intravenous immunoglobulin and its sister subcutaneous immunoglobulin, and plasma exchange. Those have been shown to be efficacious and are the primary treatments for the disease, as stated in the current EAN-PNS guidelines on CIDP. But there has been no new treatment for CIDP that's been tested in a rigorous fashion in over 30 years. So the current trial on Efgartigimod is very exciting because this is a total new class of treatment for this disease. So Efgartigimod is a FcRn inhibitor, and it's been approved in its intravenous form and its subcutaneous form for myasthenia gravis. And the mechanism of action of the FcRn inhibitors is basically to reduce the amount of circulating immunoglobulin G, IgG. And it does so in the sense relatively rapidly, over a couple weeks, to get the levels down to about 70% of what would be normal. So this is almost the opposite of IVIG, where we're giving extra immunoglobulin G from 10,000 donors. This is getting rid of the IgG in a rate in about 70% from normal. The trial was a relatively unique trial in that it's the largest trial of CIDP that's ever been done, and they screened over 600 patients and had an adjudication committee to make sure that this diagnosis of CIDP was as accurate as it could be. So roughly half the patients did not meet the criteria, and so the trial was about 330 patients. They then took those 330 patients and took them off their current treatments, which was mostly IVIG, but there was also corticosteroids. When they went off the treatments, when they showed a relapse, they would then put on the Efgartigimod, which in this instance was a subcutaneous form that they would get weekly. Of the 300 and so patients who were treated, roughly 70% of them responded to the Efgartigimod. So this was not blinded, this was open label, they knew they were getting it. When they responded to the treatment, they would then put into a double-blind trial of half of them got the Efgartigimod and half of them got placebo. So stage A was the open label part, and they had to improve from their baseline, which had dropped because they were taken off their current treatment. And there were 90 patients who had not been on any treatment for the last 6 months. Some of them were completely treatment naive, and some of them were just off treatment for a long time. The stage B, which was the double-blind trial, had to show a relapse to determine whether there was a difference. And essentially, there was a significant difference in relapse rate between the placebo group and the subcutaneous Efgartigimod. And that most of the relapses occurred, particularly in the placebo group, in the first 8 weeks, but the trial went on for 48 weeks, and they saw the significant stability with the Efgartigimod compared to placebo up to 48 weeks. So it showed a non-blinded response in stage A, and then a blinded response by maintaining the level that was improved with the treatment. So there are many things to learn from this. One of which is we never knew for sure how much immunoglobulin G played a role in CIDP. IVIG has some effect on the patient's immunoglobulin G, but has other effects. This trial shows that immunoglobulin G plays a very important role in a significant number, or probably a majority of patients with CIDP. So we're learning a little bit more about the pathogenesis of the disease based on the trial. The second thing is that this is a new class of treatment. The subcutaneous injection takes 90 seconds as opposed to 3 to 4 to 5 to 6 hours with IVIG. So there's a convenience factor that may be important for some patients, but it is immunosuppressant compared to the non-immunosuppressant IVIG. But the overall adverse events were relatively small and the infection rates were very minimal. So overall it seemed to be tolerated very well. There were some injection site reactions early on, but they seemed to dissipate with time. So overall it was well tolerated. 99% of the patients who were offered the open label trial chose to go into it, which suggests some degree of satisfaction with the treatment. So it's very exciting and encouraging.